A lot of people ask what are the advantages of laser dentistry. Laser dentistry actually offers a lot of advantages over traditional surgical treatment. The first is that it's a very non-invasive procedure. By non-invasive, we don't have to do any surgical cutting. We can actually do it without any cutting or sutures at all. The other thing is when we do the laser dentistry, it's very selective. It will selectively remove the diseased epithelium. It will also selectively remove the bacteria that cause periodontal disease. But it does not remove the healthy underlying connective tissue. So by doing that, we're taking away the bad stuff while keeping the stuff that we want. So it's very non-invasive in that response. The other thing too is most traditional periodontal surgeries are a subtractive procedure. We're removing tissue or removing bone. With laser treatment, we're actually doing regeneration. We're trying to regrow tissue. We're trying to regrow bone. So it's actually an additive procedure. So instead of taking away, we're actually putting something back. We're tricking the body into growing the bone we need to get the tissue that we need. The other thing also, which most patients appreciate, is that laser dentistry is less painful. It's far less invasive, and by being less invasive, that means the healing time is quicker, and so they have an uneventful healing time. Also, when you look at the aesthetics, when people smile, it's very hard to tell anything's even been done. And so when they look at the case, it's actually much more aesthetic than traditional surgery. Sometimes people ask, are dental lasers dangerous? And the answer is it depends. One thing that I try and get across to my patients is not all lasers are the same. There are many different types of lasers. Some lasers are good for cutting hard tissue. Some lasers are very good for cutting soft tissue. The laser that we use in our office, because we're a periodontal office, is a soft tissue laser. So it's very safe when it comes to dealing with the tissue and dealing with the diseased epithelium. But my laser would be useless if I was trying to cut hard tissue or trying to cut a tooth. Whereas a laser that might be used in a general dental office would be very good at cutting hard tissue, but actually that could potentially be dangerous because that can cause scarring and charring of the root surface. So it would not be good in a periodontal setting. So that's one thing that people need to understand is not all lasers are the same, and they need to be very specific about what are the applications for the lasers you're trying to do.